Top 25 Band 5 NHS Nurse Interview Questions and Answers. Preparing for a Band 5 NHS nurse interview requires clear examples, confidence, and a strong understanding of safe patient care. Interviewers usually assess clinical knowledge, communication, teamwork, accountability, compassion, and how well you follow NHS values. Your answers should show that you can work under pressure, escalate concerns, protect patients, and reflect on your practice. The following questions and sample answers are written to help newly qualified and experienced nurses prepare strong, structured responses that sound professional, caring, and realistic in an NHS interview setting today with confidence and clarity. 1. Tell us about yourself and your nursing background. I am a registered nurse with experience in delivering safe, compassionate, patient-centered care. During my training and clinical placements, I developed strong skills in assessment, documentation, medication safety, infection prevention, and communication with multidisciplinary teams. I enjoy building trust with patients and families, especially during difficult moments. As a Band 5 nurse, I want to continue developing clinically while contributing positively to the ward team and NHS values every shift. 2. Why do you want to work as a Band 5 NHS nurse? I want to work as a Band 5 NHS nurse because the role allows me to provide direct patient care, develop my clinical confidence, and work within a supportive multidisciplinary environment. I am motivated by the NHS commitment to equality, dignity, and high-quality care. This role suits my values because I enjoy helping patients recover, supporting families, and continuously improving my practice through reflection, feedback, and confident professional learning daily. 3. What do you understand about the role of a Band 5 nurse? A Band 5 nurse is responsible for delivering safe, evidence-based care, assessing patients, planning interventions, administering medicines, documenting accurately, and escalating concerns appropriately. The role also includes supporting healthcare assistants, communicating with doctors and therapists, educating patients, and maintaining professional standards. I understand accountability is central, so I must recognize my limits, follow policies, stay calm and compassionate, and always put patient safety first in every clinical decision I make. 4. Why do you want to work for the NHS? I want to work for the NHS because it provides care based on need, respect, compassion, and fairness. I admire the teamwork within NHS services and the opportunity to care for patients from diverse backgrounds. The NHS also encourages professional development, reflection, and evidence-based practice. I want to contribute to a service where patients are treated with dignity and where staff work together to improve outcomes safely every single shift. 5. How do you demonstrate compassion in nursing care? I demonstrate compassion by listening carefully, respecting patient choices, and treating every person as an individual rather than a diagnosis. For example, if a patient is anxious before a procedure, I would explain what is happening, check their understanding, and offer reassurance. Compassion also means noticing small needs, such as comfort, privacy, pain relief, or family involvement, and responding with kindness while maintaining professional boundaries in every interaction with them. 6. How would you manage a deteriorating patient? If I noticed a patient deteriorating, I would assess them using the ABCDE approach, check vital signs, review their symptoms, and call for senior help immediately. I would escalate according to local policy, inform the nurse in charge and medical team, and continue monitoring the patient closely. I would document findings clearly, communicate using SBAR, and ensure interventions such as oxygen, fluids, or medication are given safely and as prescribed. 7. What would you do if you made a medication error? If I made a medication error, my first priority would be patient safety. I would assess the patient, inform the nurse in charge and doctor immediately, and follow local incident reporting procedures. I would be honest, document accurately, and complete a DATX or relevant report. I would also reflect on why the error happened, identify learning points, and take steps to prevent it happening again, such as double-checking high-risk medicines. 8. How do you prioritize patient care during a busy shift? I prioritize care by identifying patients with the highest clinical risk first, such as those with abnormal observations, pain, confusion, or urgent treatment needs. I use handover information, care plans, and escalation scores to guide decisions. I also communicate with colleagues, delegate appropriate tasks, and review priorities throughout the shift. Good prioritization means staying organized while remaining flexible when a patient's condition changes unexpectedly without losing focus on patient safety. 9. How would you deal with a difficult or upset patient? I would stay calm, listen actively, and allow the patient to explain their concerns without interruption. I would acknowledge their feelings, speak respectfully, and try to understand the reason behind their distress, such as pain, fear, waiting times, or poor communication. I would address what I could, involve senior staff if needed, and document any concerns. My aim would be to reduce tension while protecting dignity and safety where possible. 10. How do you maintain patient dignity and privacy? I maintain dignity and privacy by closing curtains or doors, gaining consent before care, explaining procedures, and using respectful language. I make sure patients are covered appropriately during personal care, and that sensitive conversations happen privately whenever possible. I also respect cultural, religious, and personal preferences. Dignity is not only about physical privacy, it is also about listening, involving patients in decisions, and treating them with respect at all times. 11. How do you work as part of a multidisciplinary team? I work well within a multidisciplinary team by communicating clearly, sharing relevant information, and respecting each professional's role. Nurses, doctors, physiotherapists, pharmacists, occupational therapists, and discharge teams all contribute to patient recovery. I would attend handovers, ask questions when needed, and update the team about changes in a patient's condition. Effective teamwork prevents delays, improves safety, and helps patients receive coordinated care from admission through treatment, discharge, and follow-up planning. 12. Tell us about a time you worked under pressure. During a busy clinical placement, several patients needed support at the same time, including one with increased pain and another requiring urgent observations. I stayed calm, informed my mentor, prioritized the patient with clinical risk, and delegated simple tasks appropriately. I communicated clearly with the team and reviewed each patient after immediate needs were managed. This experience taught me that pressure requires organization, teamwork, safe escalation, clinical judgment, and confidence. 13. How do you handle conflict with a colleague? If conflict happened with a colleague, I would remain professional and focus on patient safety rather than personal feelings. I would speak privately, listen to their perspective, and explain my concerns respectfully. If the issue could not be resolved or affected patient care, I would escalate to the nurse in charge or line manager. I believe conflict should be handled early, calmly, and honestly to maintain teamwork and mutual respect. 14. What is your understanding of safeguarding? Safeguarding means protecting children, adults at risk, and vulnerable people from abuse, neglect, exploitation, or harm. As a nurse, I must recognize warning signs such as unexplained injuries, fear, poor hygiene, financial abuse, or controlling behavior. I would listen carefully, document facts, avoid making promises of secrecy, and escalate concerns through the safeguarding lead or local policy. Safeguarding is everyone's responsibility and must be acted on promptly without unnecessary delay. 15. How would you support infection prevention and control? I support infection prevention by following hand hygiene guidance, using appropriate PPE, cleaning equipment, maintaining aseptic technique, and following isolation procedures when required. I would also challenge unsafe practice respectfully, such as missed hand hygiene or incorrect glove use. Infection control protects patients, staff, and visitors, especially those who are immunocompromised or recovering from surgery. Good practice must be consistent, not only during inspections or outbreaks across every clinical setting. 16. How do you ensure accurate documentation? I ensure accurate documentation by writing clearly, objectively, and promptly after care is given. I include relevant observations, assessments, interventions, communication, escalation, and patient responses. Documentation should be factual, dated, timed, and signed according to local policy. I understand that good records support continuity of care, legal accountability, and patient safety. If something is not documented properly, it can create confusion and increase clinical risk for everyone involved in care. 17. How would you communicate with a patient who has dementia? I would communicate with a patient who has dementia using a calm tone, simple language, eye contact, and patience. I would introduce myself, explain one step at a time, and avoid rushing or arguing. I would also use familiar objects, family input, and reassurance to reduce anxiety. Understanding triggers, maintaining routine, and preserving dignity are important. My aim would be to make the patient feel safe and respected throughout care. 18. How do you manage confidentiality in nursing practice? I manage confidentiality by only sharing patient information with appropriate professionals involved in care and only when necessary. I would avoid discussing patients in public areas, keep records secure, and follow data protection policies. If a family member asks for information, I would check consent and capacity first. Confidentiality builds trust, but I also understand there are exceptions when disclosure is needed to prevent serious harm while respecting patient rights. 19. What would you do if you disagreed with a doctor's decision? If I disagreed with a doctor's decision, I would first check my understanding and raise my concern respectfully using evidence and patient observations. I would explain why I felt the decision might affect safety or care. If I remain concerned, I would escalate to the nurse in charge, senior doctor, or follow local escalation policy. Nurses have a professional duty to advocate for patients and speak up without creating confrontation. 20. How do you promote equality and diversity in care? I promote equality and diversity by treating every patient fairly, respecting their beliefs, culture, language, gender, disability, and personal choices. I avoid assumptions and ask patients about their preferences, communication needs, and support requirements. I would use interpreters when needed and ensure care is accessible and inclusive. Equality means giving people care that meets their individual needs, not simply treating everyone in exactly the same way during every patient contact. 21. How do you reflect on your nursing practice? I reflect on my nursing practice by thinking honestly about what went well, what could improve, and what I learned from each situation. I use feedback from mentors, colleagues, patients, and incidents to guide development. Reflection helps me improve communication, clinical judgment, and confidence. If I identify a learning need, I create an action plan, seek training, and apply the learning to improve future care safely and consistently for patients. 22. What are your strengths as a nurse? My strengths include compassion, reliability, communication, and willingness to learn. I stay calm under pressure and ask for help when a situation is beyond my competence. I am also organized and understand the importance of accurate documentation and safe escalation. Patients often need reassurance as much as treatment, so I try to communicate clearly and kindly. I believe these strengths support safe and patient-centered care within a busy ward environment. 23. What is your main weakness as a nurse? My main weakness is that I can sometimes spend too long trying to make every task perfect, especially documentation or patient explanations. I have learned that nursing requires both quality and time management. To improve, I prioritize tasks, ask for feedback, and use structured communication. I still aim for high standards, but I now focus on safe, efficient care while recognizing when to move on throughout each demanding clinical shift. 24. How would you support a newly admitted patient? I would welcome the patient, introduce myself, confirm their identity, and explain the admission process clearly. I would complete baseline observations, assess pain, allergies, mobility, nutrition, falls risk, pressure area risk, and mental capacity where relevant. I would review medication information, ensure documentation is complete, and inform the multidisciplinary team of concerns. A good admission helps identify risks early and makes the patient feel safe from the beginning of care. 25. Where do you see yourself in 5 years? In 5 years, I see myself as a confident and competent NHS nurse with strong clinical skills and a positive contribution to my team. I hope to develop in areas such as mentorship, acute care, or a relevant specialty depending on service needs. I want to keep learning, support junior staff, and take part in quality improvement. My aim is to grow while maintaining compassionate, patient-centered care throughout my career. A successful Band 5 NHS nurse interview is not about giving perfect textbook answers. It is about proving that you are safe, compassionate, accountable, and willing to learn. Use clear examples from placements, previous roles, or clinical experience, and connect them to patient-centered care. Speak calmly, show awareness of your limitations, and explain when you would escalate concerns. With preparation, reflection, and confidence, you can show the panel that you are ready to contribute positively to an NHS team and deliver high-quality nursing care from day one safely, consistently.